There is one crisis we all needs to pay attention to, and that is the unprecedented Brazil surge of the P1 variant, overloaded hospitals and sharp mortality spike. If more contagious P1 out of control worldwide, we are all endangered. https://twitter.com/rariciting/status/1373501475805102082. The crisis is described by the @FIO_Cruz_N as the worst sanitation and hospital collapse in the history. We're hearing very consistently that in Brazil more and more young people are dying on the virus. Doctors keep telling us that their patients keep getting younger. No comorbidities from doctors across many cities. More concerning, Brazil experts' analysis says P1 is potentially 2 to 2.5x faster transmission, more contagious than the old common strains. That means it is also faster than B117 sweeping the world. Another Brazil research group puts P1 estimate a way worse whopping 25 to 60% reinfection rate. Pfizer BioNTech and NIH Moderna. Troubling peer-reviewed paper shows even two-dose recipients have serious trouble neutralizing the B1351 South Africa variant, as little as versus old SARS and bat coronavirus. P1 is poor too, one dose worse. Brazil doesn't have the mRNA vaccines. It has the AstraZeneca and Sinovac vaccine. We don't know the exact efficacy yet for P1. Sinovac vaccine showed a much lower 50% efficacy in Brazil trials. Before P1, https://www.bbc.com/news/world-latin-america-556426448. 50% is still good, and for severe disease, it's 78% for Sinovac, so that's decent. J&J vaccine shows mid to upper 80% for Brazil. But J&J isn't available in Brazil yet. Main problem is Brazil doesn't have enough. Less than 10 million people in the country of about 220 million had received at least one dose. According to federal health data, only 1.57% of the population had been fully vaccinated. Oxford-AstraZeneca has been reported to be effective against the P1 variant, but the study has not yet been released by the researchers. The U.S. has a stock of more than 30 million doses of AstraZeneca. UK Imperial team data show P1 variant is 1.4 to 2.2 times more transmissible than other variants in original #SARS-CoV-2 strain, and 25% to 65% more likely to evade existing protective immunity from previous non-P.1 infections, susceptible to reinfection. Brazil P1 now invading neighbors. Paraguay Minister of Health confirms that the Manaus, Brazil variant is already circulating in the country. ICUs in Paraguay are now maxed out, COVID-19 deaths surging. And now P1 has invaded North America. British Columbia, Canada has a recent sudden surge of P1. Younger Brazilians are now dying from COVID-19 more than last year, likely due to P1. Age 30 to 59 saw deaths jump from mid-March by 317% versus 223% for overall. Young adult Brazilians also dying per capita much more than UK, the United Kingdom.